The reason our health system is in such trouble is that it's set up to generate profits, not to provide care. To pay for care, we rely on hundreds of investor-owned insurance companies that profit by refusing coverage to the sickest patients and limiting services to the others. And they cream roughly 20% off the top of the premium dollar for profits and overhead. Our method of delivering care is no better than our method of paying for it. We provide much of the care in investor-owned health facilities that profit by providing too many services for the well-insured and too few for those who cannot pay. Most doctors are paid fee-for-service, which gives them a similar incentive to focus on profitable services, particularly specialists who receive very high fees for expensive tests and procedures. In sum, healthcare is directed toward maximizing income, not maximizing health. Most current reform proposals would leave the present profit-driven and inflationary system essentially unchanged and simply pour money into it. An unsustainable solution. That's what's happening in Massachusetts, where we have nearly universal health insurance, but costs are growing so rapidly that its long-term prospects are bleak unless we drastically cut benefits and greatly increase copayments. We're learning that health insurance is not the same thing as health care. It may be too skimpy or too expensive to actually use. Initiatives such as electronic records, disease management, preventive care, and comparative effectiveness studies may improve care, but experts agree that they're unlikely to save much money. Promises by for-profit insurers and providers to mend their ways voluntarily are simply not credible. Regulation is also unlikely to modify profit-seeking behavior very much without a bureaucracy so large that it would create more problems than it solves. Nearly every other advanced country has a largely nonprofit national health system that provides universal comprehensive care. Expenditures are on average less than half as much per person, and health outcomes are generally much better. Moreover, contrary to popular belief, these countries offer more basic services, not fewer, more doctor visits and longer hospital stays, more doctors and nurses. But they don't do nearly as many tests and procedures because there's little financial incentive to do so. It's true that there are waits for some elective procedures in some of these countries, such as the UK and Canada. But that's because they spend far less on health care than we do. If they were to put the same amount of money into their systems as we do into ours, there would be no waits. For them, the problem is not the system, it's the money. For us, it's not the money, it's the system. We already spend more than enough. Now, it's often argued that the first order of business should be to expand coverage and then worry about costs later. But it's essential to deal with both together to stop the drain on the rest of the economy and the further erosion of health care. The only way to provide universal coverage and to control costs is to adopt a nonprofit single-payer system like that called for in H.R. 676. Anything else will either increase costs or decrease coverage, inevitably. Medicare is a single-payer system with low overhead costs, but it uses the same profit-oriented providers as the private system, so its costs are rising almost as rapidly. Setting up a Medicare-like public program to compete with private insurers, as advocated by the President, would have the same problem. and also not realize the administrative savings of a true single-payer system. I also worry that the insurance industry would use its clout to underfund the public program and make it a dumping ground for the sickest, costliest patients, creaming off the profitable ones for themselves. I'm aware that phasing out the private insurance industry would mean a loss of jobs, but I believe the job loss in that sector would be more than offset by job gains in the rest of the economy, which would no longer be saddled with the exorbitant costs of an industry that offers almost nothing of value. Thank you very much, and I look forward to your questions.